5. For what purpose does the gentleman from South Carolina seek recognition?
Mr. Speaker, I have an amendment at the desk.
The clerk will designate the amendment.
Amendment number 13, printed in Part A of House Report number 119-255, offered by Mr. Norman of South Carolina.
Pursuant to the House Resolution 682, the gentleman from South Carolina, Mr. Norman, a member opposed. Each will control 5 minutes. The chair recognizes the gentleman from South Carolina.
Thank you, Mr. Speaker. My amendment prohibits provisions of gender transmission procedures, including surgery or medication, through the Exceptional Family Members Program. The Exceptional Family Members Program provides resources to military families with special needs. This program is designed for military spouses, children, or other dependent family members who require ongoing medical or educational services, such as individuals with asthma, autism, chronic respiratory illnesses, intellectual disabilities, and much, much more. Under the Biden administration, the Air Force suggested using the Exceptional Family Members Program for families who want to help their child transition. Democrats also introduced a bill to expand this program to include transgender dependents and specifically list gender dysphoria as a qualifying medical need to be included in the program. My amendment ensures that we reserve this valuable program for its original intent to help families with special needs by prohibiting the use of the program for the provision or referral for gender transition procedures such as gender surgery or medication. The Exceptional Family Members Program, otherwise known as EFMP, should be used fully to support families with special needs and chronic illnesses, not for gender transmission procedures, as has been mentioned. The program, as it was intended, specifically identifies certain things that identifying families with special needs, which includes the following: potentially life-threatening conditions or chronic, current or chronic mental health conditions, asthma or other respiratory-related diagnoses with chronic reoccurring symptoms, intellectual or development delays, attention deficit disorder or attention deficit hyperactivity disorders, chronic conditions that require adaptive equipment, which assistive technology devices or environmental or architectural considerations. Allowing gender transitioning procedures through the EFMP goes against the very intention that the program was designed to have, and it provided valuable resources for families who otherwise would not have the funds to do so. Gender transitioning is not covered under any of the criteria for identifying individuals eligible for the EFMP. I ask for adoption of this amendment and yield the balance of my time.
Does the gentleman reserve?
Gentleman reserves.
Gentleman reserves. What purpose does the gentleman from Washington State seek recognition?
To claim the time in opposition to the amendment.
The gentleman is recognized for 5 minutes.
Thank you. I yield myself 2 minutes.
The gentleman is recognized.
There's going to be 5 amendments now that are all targeting the transgender community. And I want to make sure we understand a couple of really sort of broad themes, why these amendments are so problematic. Number one is the transgender community has been targeted and discriminated against aggressively. If you troll through right-wing radio or online messaging, they're called freaks and weirdos. They are dehumanized on a very consistent basis in a way that has led to violence and discrimination against the transgender community. All 5 of these amendments just put a little exclamation point on that and encourage people to continue to dehumanize transgender people in a way that is very, very dangerous. So that's number one. Number two, transgender people exist. That's just a fact. Gender dysphoria is a medical fact. No serious medical person disagrees on that point. It's not even debatable. Now, there are a couple things that are debatable. What do you do about it? What treatments are appropriate in a given set of circumstances? Personally, I think it's wide open to have that conversation. What should the medical profession do? Second, when you have a transgender woman or a transgender man, how does that work in terms of sports and a wide variety of different things with women's sports or men's sports or anything? You can have a conversation about how to fit that in. But acting like transgender people don't exist further contributes to their dehumanization and the discrimination against them. None of these amendments before us today are even remotely necessary. They are simply an effort to take advantage of a culture war partisan issue to drive a wedge into this bill. It doesn't belong here. And on this particular amendment, if you are a service member who has a child experiencing gender dysphoria, what this amendment says is your child doesn't actually exist. That's not really happening. How is it going to make a service member feel when they're trying to take care of their child? I have met with children who went through gender dysphoria, who credit the treatments that they received. I yield myself an additional minute. Who credit the treatments they've received for absolutely saving their lives. Now, do sometimes they make mistakes? I always like to say, I've had 3 hip surgeries, including 2 total hip replacements. I probably didn't need any of them. It was probably a mistake. I don't see here anybody on the floor talking about banning hip replacements because occasionally you do one wrong. That happens. This decision should be made by doctors and patients, not by congressmen and legislators. This is restricting health care that could be incredibly necessary for young people, also for other family members. It is bigoted, discriminatory, and unnecessary, and I hope this body will turn it down. I reserve the balance of my time.
Gentleman reserves. The gentleman from South Carolina is recognized.
Well, all I would add to that is, you know, we've got an obligation to the American people to keep this country safe and have our finest military men who are willing to risk it all in defense of America. My friend on the opposite side of the aisle mentions hip surgery. I think that's entirely different than a sex change operation that doesn't say that a person doesn't have it, but it's the military, the funding is not, that's not where the money should come from. How about telling that child that's got asthma, he has no treatment? How about telling that child with a mental impairment, there's not money to do it, we have to put the money towards somebody who's not sure about what sex they are. So it's just not a priority in the military, nor should the funding be set aside for that. There is a set amount of dollars that have to go toward this valuable appropriation process, and it's not to determine what somebody's sex is. He needs to decide that in other places with their own money and other times. I reserve.
Gentleman from South Carolina reserves. Gentleman from Washington State.
May I inquire as to how much time is left?
Gentleman has 2.5 minutes remaining.
I yield myself 1 minute to make
Gentleman is
3.
recognized.
I'm sorry, how much time does he have?
The gentleman from South Carolina has 1 minute remaining.
Thank you. I yield myself one minute. 3 quick
Recognized.
points. Number 1, this does not restrict other medical treatment for anybody else. It's got nothing to do with this whatsoever. Second of all, this doesn't just eliminate sex change operations. This very specifically eliminates any treatment for gender dysphoria. A lot of times that's mental health treatment. That's not surgery. That's not drugs. That's a conversation about that issue. It eliminates it for everybody. Third, yes, we need to put our service members in the best position to focus on their mission and on fighting. If you are a service member overseas, stationed, fighting, and you have a child who is experiencing gender dysphoria, and you are told that your child, who is in a very dangerous situation, cannot get the health care that they need, that is not going to help that service member be the best possible fighter they can be for this country. We should not be denying health care to the family members of our service members that they need, and that is what this amendment does. I reserve the balance of my time.
Gentleman from South Carolina is recognized.
Let me just put some numbers to this. Over the course of 5 years, the Pentagon spent $15 million in treating 1,892 transgender troops, including $11.5 million for psychotherapy and $3.1 million for surgeries, according to the Department of Defense. The price tag for individual gender-affirming surgical procedures and other medical treatments can range from $8,000 to $100,000. And to compare hip surgery to a sex change operation is two different worlds, two different thoughts that we just have a completely difference of opinion. And I think if you take a survey of any of the troops that are serving this country, the vast majority would say that transgender surgeries have no place in the military. And the public, to be born with that price tag is, to be honest with you, incomprehensible. I reserve.
Gentleman's time has expired. Gentleman from Washington is
Again,
recognized.
we're not talking about sex change operations, and this is just another example of the profound ignorance surrounding treatment for gender dysphoria. We were talking about any treatment. And with that, I yield the balance of our time to the gentlelady from Hawaii, Ms. Takuda.
The gentlelady from Hawaii is recognized.
Thank you, Mr. Speaker. My colleagues, I rise in strong opposition to this amendment. Let's be clear. The Exceptional Family Member Program does not pay for medical care. Its purpose is simple: to ensure that military families are stationed where medical and educational services they need are available. This amendment misrepresents the mission, and it undermines it. We ask our service members to sacrifice so much for this country, in many cases even their lives. As a mother, I would never ask them to sacrifice their child's well-being. That's not just offensive, that's cruel and it's inhumane. Gender-affirming care is health care. Denying it sends a harmful message to military families with transgender children, that their needs, their dignity, who they are, their very lives do not matter. And when we harm their families, when we hurt their children, we undermine the very readiness we are so focused on as a military. The very people that we rely on to be on the front lines defending this nation every day. Our service members put everything on the line. We should do the same for them. Vote no on this amendment.